So now we're going to go over preoperative teaching. There's 4 different sections of preoperative teaching. You have your assessment portion, you have planning, you have implementation, and then you have evaluation. All of those are going to be incorporated in the preoperative teaching. So with the assessment, you're going to identify your patient, introduce yourself. You're going to gather a history of surgeries and anesthesias and how the patient reacted to those. You're going to determine the patient and the caregiver's understanding of the surgery, and then you're going to determine the patient's cognitive level. You would do that by asking all the initial questions. You would understand the patient's cognitive level as well as with your preoperative assessment, which would be done before the teaching. You're going to assess the patient's risk of respiratory complications. You're going to assess the patient's anxiety level towards the surgery. You're going to assess the caregiver's willingness to learn and support the patient, and you're going to assess the patient's medical orders. After your assessment is your planning. When you're planning, you're just going to identify the expected outcomes of the surgery and make sure that the patient understands those. And then you're going to start your implementation part of the teaching, which is then you're going to wash your hands. You're going to inform the patient and the caregiver of the date, the time, the location of the surgery, how long the surgery is, how long the recovery time is, and even where the waiting rooms are for the family and the caregiver during surgery. You're going to answer any and all questions that the patient or the caregiver gives you fully to their content. Then you're going to give all the preoperative instructions for the patient. So things like bowel and skin prep, showers, even like how often they need to shower before, or if they need to shower before, the clothing that they're wearing and ensuring that it's clean after they shower, things like that. You're going to teach them on fluid restrictions and the purpose of fluid restrictions and eating restrictions and why you're doing that as well. Then you're going to describe all the preoperative routines and the effect of the preoperative medicine. So the routine meaning like when to shower, when not to shower, you're going to describe those to the patient and why you're doing it. And then any kind of preoperative medications that you're describing is going to be like a skin prep or a bowel prep. So you're going to describe what that is, why you're giving it, and the effect that what it's going to do, so that the patient is not just drinking something and not understanding what's going to happen and then freak out because they don't know what's going to happen next. You're going to, after doing all that and evaluating the patient's understanding of all that, you're going to review any medications the patient's currently on, like routine medications that may need to be stopped before the surgery. You're going to go over perioperative sensations, so things that they could feel during surgery, before, during, or after surgery would be perioperative. And then you're going to instruct the patient on post-op pain control methods and what the goals are and what the options are for post-op pain control. You're going to explain the post-op experience, basically when they leave surgery, that they go to a post-op room where they're observed for a few hours normally and monitored after anesthesia and coming out of anesthesia and things like that. Then you're going to instruct the patient on different exercises that will help prevent post-op complications, like turning. You want the patient to turn every 2 hours, but you need to instruct them how to do it correctly and the goals of it and the reason for doing it. Then you're going to instruct the patient on coughing and deep breathing. You want them to understand what they're doing, why they're doing it, and how they're doing it, and how often they should be doing that. You want to instruct the patient on using an incentive spirometer, the same thing, why, how, and how often. And then PEP therapy, which is the same. You want them to do that every 2 hours, and you want to be able to show them how to do that and instruct them on how to do that clearly. Huff coughing, controlled coughing, and even leg exercises, how often they're doing it, why they're doing it, and how they're doing it. And then once you're done describing all of that to the patient, you're going to have them show you how to do it so that you can evaluate their level of understanding on that. And once they can show you that they know how to do it, you're going to have them start doing it before surgery so that they get into that routine, and that so you can evaluate that they actually do know how to do that and are capable of doing it. So they're going to start doing that every 2 hours prior to surgery. Once you're done showing them all of that and they can show you everything and able to perform it, you're going to go to your evaluation part. So you're going to observe the patient's understanding of all the learned skills. Then you're going to evaluate that the family understands where the waiting room is and how long they're going to be there and things like that. You're going to ask the caregiver if she's willing to help and prepare the patient for surgery. You're going to observe the patient's emotional support from the caregiver and the family. You're going to ensure that the patient understands the medications that need to be stopped. And you're going to identify all unexpected outcomes of the surgery and make sure that the patient understands those. And then once you're done going through all the evaluation part of the pre-op teaching, you're going to document everything, all the information that was provided and all the information that the patient was able to give back to you and show that they understood how to do that. And then that is it for pre-operative teaching.